Hello everyone. In this video, let's quickly review the disorders of genomic imprinting. Before going into the disorders per se, we must understand what exactly imprinting means. Imprinting means silencing. Silencing of what? It is silencing of one of the alleles of a gene. It can be paternal allele or the maternal allele that can be silenced. We must understand a basic concept here that imprinting is a normal phenomenon. If it's a paternally imprinted gene, then the silencing occurs during spermatogenesis. And if it's a maternally imprinted gene, then the imprinting occurs during oogenesis. What normally happens is that you get one copy of an allele from spermatocyte, i.e. from your father, and one copy of an allele from oocyte, i.e. from your mother. And then the resultant zygote has two alleles of a gene that are functional and are capable of expressing themselves by classical Mendelian inheritance, depending on whether they are dominant or recessive. This is what happens with most of the genes. Now let's see what happens if the gene is paternally imprinted. Look at the sperm. Look at this allele. This particular allele is silenced. Now, what does that mean? It means that it no longer will be able to transcribe itself. At the molecular level, this mechanism of silencing is occurring by methylation. So, what is methylation? It's basically an epigenetic modification. You are adding methyl groups to cytosine residues of CpG islands of the promoter region of the gene. What essentially is happening is that now the transcription factors cannot bind to the promoter region. We can think it like the methyl groups have been added, so there's no place for the transcription factors to come and bind to the promoter region. So transcription is suppressed. In this way, the gene is silenced. So what happens in a gene that is paternally imprinted is that since the paternal allele is silenced, it is the maternal allele that has to do all the job. Now the disease basically happens when the maternal allele is mutated. This is what exactly happens in Angelman syndrome. Angelman syndrome is characterized by paternal imprinting. It means that the gene responsible for the Angelman syndrome is normally silenced in the spermatocyte. Now the disease is occurring because of the deletion of the gene that is present in the oocyte. Now this is what exactly I have been trying to explain. And this particular phenomenon occurs in 70% of the cases. In remaining 20 to 25% of the cases, there occurs a phenomenon called uniparental paternal disomy. What this essentially means is that the imprinted allele containing paternal chromosome is actually getting duplicated, which is what I meant by paternal disomy. So the maternal allele, which is actually carrying the functional allele, is not there, and there are two copies of paternal allele which is not expressed, which is not getting expressed because it is silenced. The gene that is responsible for Angelman syndrome is UBE3A, which codes for ubiquitin ligase, which is present on the long arm of the chromosome 15. Now let's look at the clinical features of the Angelman syndrome. They typically present with inappropriate laughter, hence they are known as happy puppets, and they have intellectual disability, mental retardation, ataxia, and the parents should be warned uh, about the risk of the seizures that may develop in these children. Well, this is just a photo of a child suffering from Angelman syndrome. We can see the laughter. They always keep laughing, and it's also known as happy puppet syndrome. Now let's look at maternal imprinting. Look at this oocyte and look at this allele. This particular allele is normally silenced in all the normal individuals. Now, it's the paternal allele that has to do all the job. So, the resultant zygote will have one allele that is functional and one allele that is silenced. Since it's the maternal allele that is silenced, it is known as maternal imprinting. Now, the disease happens when the paternal allele is getting mutated. This is what happens in Prader-Willi syndrome. It's characterized by maternal imprinting with mutation of paternal allele, which occurs in 70% of the cases. And in the remaining 20 to 25% of the cases, it's characterized by uniparental maternal disomy of the imprinted gene. The genes which are implicated in the Prader-Willi syndrome are the SNORB genes, which are located on the long arm of the chromosome 5. Now let's look at the clinical features of the Prader-Willi syndrome. It's characterized by hyperphagia, leading to massive obesity, and it's characterized by short stature, short hands and feet, hypogonadism, intellectual disability, and hypertonia. Hypertonia, which is the decreased muscle tone, is often the earliest manifestation of the Prader-Willi syndrome. You can see hypertonia in this baby, and the morbid obesity that develops as a result of hyperphagia. I hope I was able to give a good understanding of the pathogenesis of these disorders and an overview of the clinical features. If you like the video and want more such videos, do ask for it in the comment section, and please like the video and subscribe to my channel.